Good afternoon. Uh, Usually I don't like to introduce myself, but today, because I surprised that David surprised after 10 years that I am Egyptian. He thought that I am from UAE. So I am Yasser Farahat. I am professor at Tanta University here in Egypt, but I moved to Dubai last 10 years. Remember that, okay? So it's really a great honor to be here today. I'm happy to have this first scientific meeting that has been organized by Dar El Zokora. It's really a great idea to have a specialized center. This is why I tried to select the topic, because I visited one of the branches of the Dar El Zokora, and I really impressed with the concept that has been started to be established to have a specialized center that cover. But to discuss how to have established a men's health clinic or a center or organization or institutes, it can be different ways, by the way. It can be either basic, simple, or it can be a comprehensive one. But for sure, there are basic things that you need to have a space, you need to have a team, you have to define the specialty that you have to cover, you have to define the services that you need to provide. And if you have the complementary things or what's essential that patient needs from the pharmacy or a store, or you have to build the trust and the patient acquisition. But if you think about the space in our current time, it's not only physical space. Virtual space is also an important thing that you have to be ready to treat your patient with. And the most important thing, the accessibility of this center. If you look to inside the waiting area, patient with andrology or men's health, keep in mind always the confidentiality that patient is looking for it. So even in the waiting area, it shouldn't be that crowded that patient lose the trust and he feel that he is exposed. As much as you can, try to have the privacy and confidentiality of the patient. You have to keep the front desk that can help the patient to get booking or check-in, check-out. And you have to keep the workstation for your staff in the back end that can help you for documentation and helping for other work. Consultation room, usually the mistake that we are doing in having the examination during the consultation room, I think with the patient of andrology or men's health, this is something we should think about it. If patient comes, step in your clinic with his partner or as one of the families, having two separate consultation room than examination room is very important. To have a procedure room, if you want to add more service, as long you want to be more comprehensive, a procedure room that you can accommodate the equipments that you need. Either you have a shockwave, if you have a urodynamic, if you have ultrasound. So you have to prepare your center or your clinic to a procedure room as well. The virtual space, as we mentioned, it's has criteria that we have to fulfill. Again, the privacy and confidentiality. Don't have a lot of traffic, a lot of crowd inside your camera, because patients should feel confidentiality even if it's virtual. You need to build up a strong connection, high resolution, and the most important, easy interface that patient can utilize it even on his mobile application. Don't go to a sophisticated software that patient will feel difficulty. Although it's very important and is useful, but keep in mind that it has some limitation, especially regarding patient examination or local physical examination, and sometimes the connection, direct communication or networking with the patient. So keep the virtual to limited just for follow-up or just sending some information to the patient. So you have that space, both physical, both virtual, but you have to think how to build your team based on the services that you need to define how to provide to the patient. So you couldn't do everything yourself. So you have to build a team, either physician to help meeting new cases, preparing pre-operative, following post-operative. You have to build a well-trained nursing team or assistant nurses that have to give the injectables or to have in assisting patient evaluation or patient questionnaire. You have to build the people are capable to run the front desk activity, as I mentioned, appointment, check-in, check-out of your patient. And the most important, and we are sometimes missing, that you have if you are a good center with a high volume of cases, that you have to keep the documentation for research. If you can include in your team a research student or research fellow that he can help in documentation and giving you the analytics and the statistics of the results, the complication, the type of patients. So this is very important, and publication can be the second step that can help your recognition at the center. Having other technician like ultrasonographer for Doppler, having a urodynamic technician also, it can be based on the service that you want to add. Urology specialties, if you think about what other specialties can be relevant to men's health or to andrology, you have to select what can fit based on your objective. For sure, the sexual medicine and its subspecialty is an important. Oncology, especially the prostate cancer, you have to get someone in your team more familiar to deal with the patient, either for diagnosis or follow-up after radical prostatectomy, voiding dysfunction, and all of us know the common association between the PBH and erectile dysfunction. So treating a patient with both symptoms is very important. Male infertility or couple infertility sometimes is essential to have it in your center or your clinic. If you want to go to a comprehensive one, general urology, whatever you want to add for stone diseases, for other things, so this is your decision. Sexual medicine, as I mentioned, you have to define and to be clear to your patient what you can provide, treating erectile dysfunction, Peyronie's, hypogonadism, ejaculatory dysfunction, and for sure the different options of penile prosthesis. When you're treating the erectile dysfunction, you have to keep in your team also who can able to have the behavior or couple sex therapy, providing Doppler ultrasound service, medical treatment to be available, or local application like intraurethral or intracavernous injection, shockwave, or penile prosthesis for sure. So this is the services that you can provide for erectile dysfunction patient. So for Peyronie's disease, sometimes we are not facing that cases frequently, especially maybe in our region, but we have to be ready also for such kind of patients with Peyronie's disease to be evaluated. I think also either diagnostic or therapeutic. I know the local injection is not available anymore. Zybex is available now, David, in UK, or not anymore? Is not anymore. Any alternative available? So theoretically, interferon, other things, but practically nothing can be worked. So mostly the Peyronie's to be evaluated, which one need really a surgical intervention, or those who can be postponed later on. Treating with a patient with a hypogonadism, so you have to be linked with a laboratory that can provide you the accurate results and can do all hormonal analysis that's required. You can be ready for providing testosterone treatment, whatever the modalities available, and also other hormones. Oncology, as I mentioned, you have to decide which is more common or who you are include in your activity. But again, the prostate or bladder cancer, and either to diagnose or to follow up those patients and to have the option to get the biopsies. So this can be added. Voiding dysfunction, it can be one of two options, either in office that you can do the basic diagnostic stuff like urodynamic or uroflowmetry or cystoscopy or day case procedure for resume or other things, or you have, if you are a part of a hospital, or you can refer to another one for inpatient, so whatever needed for enlarged prostate. For fertility, the basic surgery also should be defined. If you do varicocelectomy, if you do vasectomy reversal, or if you are advanced and you can do the sperm retrieval with different techniques, so you need to establish the laboratory for that, the microsurgery, and the cryopreservation if you want to go a higher comprehensive result. Some patients comes with associated symptoms like those with prostatitis, chronic pelvic pain syndrome, or calgia, so those should be classified and categorized that you can provide the service to those kind of patients in addition to erectile dysfunction. Non-urological services, whatever you can add, if you have a physiotherapy, behavior or sex or couple therapy, if you have cardiologists for evaluation or endocrinologists to help in preparation, patients with diabetes or hypogonadism, nutrition also is required for a patient for men's health or erectile dysfunction. Some of them could be in person or physically available, others could be virtually, so nutrition can be done through online evaluation with your patient. The most important to prepare your nurses or your team to go for questionnaire. Most of our patients for men's health or andrology comes with a subjective symptoms. So we need to make these symptoms reliable to be shifted to an objective data that can help you to build a right diagnosis and to take the right decision to treat the patient. So a lot of questionnaires, some of them are relevant to urology or non-urology for those psychogenic patients who having multiple. So to build the objective data to better evaluation is very important. To have your own pharmacy or you have linked to another pharmacy to provide the most specific products that you need for a men's health, including whatever required for patients with erectile dysfunction. And also if you have the option that you have your own store in your center or your clinic for devices that required to the patient. So trying to make the patient life easy, that everything could be accessible instead to stock of unavailability of some products or some medication. The most important thing, the patient acquisition. I put a / marketing. I need to change our concept. Patient acquisition, you have to build the trust that you are the center of excellence. Center of excellence is not a title. You can build exactly. There are criteria to be a center of excellence. JCI is the biggest one that evaluate everything, but it's really complicated. But there are SRC or other centers that will put you a criteria. If you follow, you will be really considered and recognized as a center of excellence. Once you have achieved that, so you are building the really trust, and here you can do what's really patient acquisition. You build the trust. It's not going to a market. Marketing is required and it's important, but it comes as a second phase once you really recognized as a center of excellence. And then this will come spontaneously, that you will increase internal referral between different departments. You can increase the referral between you and the other colleagues, and the direct communication or marketing with the sponsor, as we are here today. Without our partners from the pharma or equipments company, we cannot be here together today. So this also a good way that you can improve your exposure. And the direct marketing, as everyone knows, that can be direct customer relationship through TV, radio channels, social media, other things. But keep in mind that you need to build your trust. You be really a center of excellence, and this will help you to have a patient acquisition and patient trust. So in conclusion, we have a different ways to establish a men's health clinic. Not all what I mentioned should be there. Everyone should define what he needs and what he wants to target from his patients. So keep in mind that, as I mentioned, that you need to have things maybe in-house, or it can be in connection with others. So you can be a separate independent center, or you can be a part of a big institute or a hospital running the men's health department, or you can be affiliated to somewhere where you can refer to additional service that you need to the patient. Keep in mind that disease prevention or diagnosis is very important. It's not that patient comes without proper diagnosis, he will not get the better treatment. So coming back again to the questionnaire to validate the symptoms, that patient sometimes is the psychogenic element is more higher aspect, so you have to diagnose the patient and to choose the proper patient. And again, it's your decision if you can do this procedure in your clinic based on what you can provide, or can this be done in affiliated center or a hospital. So this is a quick review, and I believe many of you here have some experience about how to establish the mental health. Thank you for attention, and ready to have any questions.